Hi, this is Dr. Schmo from Minnesota Functional Neurology, and what I want to do right now is just give you a brief 2-minute overview about what I'm going to be presenting on at the ACA Functional Neurology and Concussion Symposium at the end of July in Orlando. So here's the basics. I am going to try and integrate your neurological exam with your biomechanical orthopedic examination of the cervical spine. And what are the things that we need to look at? Obviously, patients are going to be coming to see you in pain. They're going to have tissues that are causing a nociceptive barrage and activating pain pathways in the brain. So what we're going to do is look at this from a peripheral standpoint, but also a central standpoint of what can be going on in the brain of that patient with persistent symptoms. So we're going to look at the pain generators and then figure out how do we reintegrate that person's cervical spine to allow them to have appropriate activation of muscles, appropriate mobility, and what can we do to reintegrate them back into their everyday life to be able to run, to move, to jump, to do the things that they want to do and play the sports that they want to play. So one of the things that we need to really try and figure out is, do we move into more of a muscle activation, mobility, myofascial, soft tissue type of therapy, or do we move into more of a sensory motor integrated model where we need to do work with the vestibular system, the ocular motor system, or integrate the cervical spine, the ocular motor, and the vestibular together? In which direction do we need to go with that person? What's going to be appropriate for their brain, and is that going to allow them to move in the right direction to get back to overall functionality and be able to do the things that they want to do? So that's what I'm going to put together for you guys. It's going to be a 4-hour clinically based hands-on presentation, and I'm really excited to see you guys all there at the end of July.